Today we're going to be having a patient come in that we're going to treat for some knee osteoarthritis. So the patient has been having really high pain while they're walking around. So what we want to do is we want to use some electrical stimulation to help with their pain and everything, and just kind of bring it down as best as we can. So the type of electrical stim that we're going to use is going to be a biphasic pulse current, or more specifically a high rate TENS, to help modulate that pain by activating the A beta fibers to block out some of their pain nerves as well through the gate control theory. So what we want to do with that, with the high rate TENS, is we want to set a pulse frequency of 100 pulses per second, and then we want to hit a pulse duration of 100 microseconds. And then we're going to do that with the patient for about 20-30 minutes to really help get that pain controlled and bring it down as best as we can. So when the patient comes in, we just want to make sure that we, like, a precaution is just that we know where the pain is coming from, and we know that it's a specific area, which is knee osteoarthritis, so we'll be okay with that one. Obviously, an indication to do the electrical stim is the pain that they're feeling in their knee, and some contraindications that we want to look for with the patient: that they don't have any local tumors in that area. We don't want them to have any deep vein thromboses down in their leg at all, so we'll have to check that before we start. Also, like pacemakers, if they're local at all, which the knee should be fine to use. If the patient's pregnant, which we will check as well, just to make sure that they aren't pregnant or anything like that. And then also we want to make sure that they are having good cognition with their leg, like that they can move normally, and then that they don't have like any open wounds or anything like that, that their skin isn't already irritated. So we'll just check all that when the patient comes in.
Okay, Colton, how are you doing today?
Doing well.
Is it okay if I call you Colton?
Yeah, that's fine.
Okay, so Colton, I saw you're coming in here today because you're having some pain in your knee from some osteoarthritis that you've been having. Yeah. Okay, so I just want to hurry and put these towels underneath here because I saw, I guess after we did some range of motion stuff, I noticed that you lacking a little bit of extension in your knee, so just make you more comfortable there.
Thank you.
So Colton, from going through everything with you earlier, I did notice that like your pain's super high, kind of an 8 out of 10 when you're moving around walking. Is that right?
Yep.
Okay, so what we want to do is to kind of help with that pain, since we've already done our exercises and everything, I want to put some electrical stim on your knee to kind of help with the pain and everything like that, just decrease it and everything, if that's fine with you.
Yeah, that's fine.
Okay, so first, is it okay if I put my hands on your knee just so I can feel around and make sure that we're getting good sensation to your knee and everything like that?
Mm-hmm.
Okay, so I'll just come around, feel around here. You feel my hands on there? Sorry, they're super cold.
Yep.
Okay,
That's fine.
Perfect. Just make sure that that's feeling well. And then also, before we get started, do you have like any, have you had any cancers or anything like that around like your knee or anything? Okay, and then also, do you have a pacemaker or anything like that at all? It does not necessarily matter where it's on your knee, but I just like to make sure, just because some people get freaked out about it. Okay, so what I'll do is I will get this, all these pads set up on you here. I'm just going to go on either side of your knee, just right on the joint line to kind of help with everything, okay? Just kind of get those through the muscles. And then we'll hook these little stim pads on here. Colton, have you had electrical stim before?
No, it was the first time.
Okay, so what we're going to do is when I start it up, it'll be just like a little tingly sensation when you first start feeling it. It won't hurt or anything like that. So as soon as you start feeling that, just let me know once I get this thing started.
Okay.
And then with it, like I said, we don't want any pain or anything. So what I want it to be is a comfortable tingle on there. Okay. So just once it gets up to the point where you feel a comfortable tingle, then we'll be good, and we can just leave it right there. And we'll go for about 20 minutes on here. Is that okay?
Yeah, that's fine.
Okay, perfect. So let me get this thing set up, and then we'll start it up, okay?
That's good.
Okay, so what we're going to do, we're going to do a biphasic pulse current and stuff, and then I'm just going to bump up the time here to 20 minutes. You're going to put this on continuous, and then just ramp time of 2 seconds. So for the rate, I'm going to move it up to 100. So we have a better, I guess, a more smooth pulse and everything. And then also for the width, I'm going to go down to 100 as well. Since we don't want to be stimulating like muscle contractions or anything, we'll just stay there to stimulate the sensory like nerve fibers. Okay, so what we'll do, Colton, is I'll start this up here for you. Okay. I'll start going up on the intensity first. So like I said, just let me know when you first start feeling it. Just be like a little tingly sensation.
Okay. Yeah, I'm starting to feel it.
Okay, so now what we want it to be is we just want it to be comfortable on there, so we don't want it to hurt or anything. So once it gets to that point, just let me know, okay?
Okay. That's good.
Okay, sounds good. I will start this up. We'll go for 20 minutes on here, and then as soon as that is done, we'll take you off, okay? Feel okay, not hurting or anything like that?
No, that's good.
Okay, sounds good. And then once we get done with this, that'll be it for today, since we wanted to relieve that pain and everything.
Cool.
And we'll let you get out of here and get back to life. Sound okay?
Sounds good.
Okay, perfect. And then I'll stop this for you. And I'll take these off. Sorry, I might pull on your leg hairs a tiny bit.
You're good.
Perfect. Doesn't seem like the pad's burned you or anything, which never happens, but it's always something we just got to make sure.
Okay.
Sensation feeling okay on your knee? Hurt or anything like that?
I mean, it feels a little better now.
Okay, sounds good. That's what we want to hear. And then you are good then, because there's nothing else that I want to look at on your knee. I'll just move this, and you are good to take off. Okay.
Cool. Thanks.